If you are a psychologist, counselor, or mental health therapist looking to expand their work in a way that you are able to provide care for children, then you might want to add play therapy to your list of things to include in my practice. Play therapy in general is a wonderful way to help children and adolescents work through their challenges, may it be behavioral, communication, or emotional. Play therapy is a practice where therapists provide care for children and adolescents through play. Play meaning exciting activities that have them express themselves freely through interacting with others and even through toys. In the professionals' play therapy space, there will be a wide variety of things that children can engage with. There will be toys that they can play with to exercise their imaginations by making scenes. There are games that they can play with other kids to help them develop relationships and learn how to communicate with others, plus art materials to help them exhibit their creativity and share it with others. The goal of any professional using play therapy for their work is to help kids develop ways to process their emotions healthily and intelligently so that they can become more resilient during times of distress. Play therapy is primarily for children and adolescents, and it is usually used when parents or guardians enroll them in a play therapy program because of suspected or confirmed challenges that a child is having when it comes to emotions and behaviors. When we say challenges, we mean difficulties and conditions like social anxiety, attention deficit, hyperactive disorder, autism spectrum disorders, working through traumatic events, processing grief, and a whole lot more. Although rare, play therapy can also be used on adults who are seeking help beyond simple talk-based therapy. If they have PTSD, suffer from depression, or some other mental health issue or disorder, play therapy can help them rediscover their inner child. Play therapists often employ play therapy techniques in two ways. There is non-directive play therapy, where the health practitioner will let kids just enjoy whatever activities and materials that were prepared, or directive play therapy. This is the opposite of the former. For this type of play therapy, the practitioner is more involved. They will be providing and conducting activities with the goal of helping kids develop communication and problem-solving skills. Types of technique used in play therapy are art therapy, a type of play therapy technique where art materials are given to kids to help encourage them to express their emotions in imaginative ways, music therapy, where music is used to help them explore, express, and control their emotions, movement therapy, which is a good way to build confidence, especially if dance is the type of movement therapy being used, bibliotherapy, which involves the use of books and storytelling to help children identify with something, whether it be character, a plot, or a theme, drama or theatre therapy, which teaches children how to act, which makes them more comfortable expressing their emotions in positive ways, and even builds self-confidence, puppet and doll play therapy, which is similar to drama therapy, but in this case the kids will use puppets or dolls to have them act out the scene. There is nature therapy, where you take your kids on a short trip to see nature where they can run around and enjoy the natural world. Animal-assisted therapy, where animals such as cats and dogs can help them. Building therapy, which involve using materials like Play-Doh, Lego, and other toys to help them develop motor skills, critical thinking, and problem-solving skills. And play-based group therapy. This type of play therapy will have kids interact with other kids in order to help them learn how to communicate as well as develop trust and rapport. Here are some activities regularly used in play therapy which incorporate some of these techniques. There is magic wand play. This particular play therapy activity requires a wand. For this particular activity, kids only need to wave their wands and make 3 wishes. It's a fantastic way to get them to say what they want out loud. If they can verbalize it, they might want it even more. Next is sock puppet making. For this one, make sure to have a lot of socks that can be used by kids to make characters. Therapists should make their own sock puppets and then use those sock puppets to talk to the kids. The kids can respond by making their own sock puppets and having them talk to yours. This is a good way of making themselves more vulnerable to you because this is an opportunity for them to speak about themselves through their sock puppets. To learn more about play therapy and how it can be used in your practice, read our guides in our Care Patron platform, which you can find through the link in our description. Check out our guides playlist to learn more about topics similar to this. Thank you for watching our video at Care Patron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Care Patron channel or click on one of our recommended videos.